Hi friends, I am Dr. Pratap Singh Rathore. I have done the MD in Forensic Medicine, and today we'll continue with abortion. In that, we'll discuss about MTP, that is Medical Termination of Pregnancy. So, Medical Termination of Pregnancy is a form of justifiable, you can say, a justifiable form of abortion or therapeutic abortion. It is a medical termination of pregnancy where abortion is induced by a medical professional in good faith to save a life of a woman or other conditions under a therapeutic need. So, it is done by medical professional under certain conditions to save a life of mother or to other indications which I discuss. It came into force in 1972. First, it was amended in 1971 and came into force in 1972. Later on, the changes were made in 1975, 2002, 2003, and in the latest changes were made in the 2021. So, under the MTP, MDK Act 1971, the indications for medical termination includes, first of all, it is therapeutic indication, in which it is done mainly in case to prevent any injury to the physical health of pregnant woman. If the woman is suffering some certain diseases and she is pregnant, then continuing the pregnancy may lead to some adverse effects or adverse effects may endanger the life of a woman. So in that condition, pregnancy MTP can be done. Like some cardiac diseases of grade 3 and grade 4, chronic glomerulonephritis, intractable hyperemesis gravidarum, malignant hypertension, epilepsy, carcinomas, diabetes, or toxemia pregnancy in this condition. Any other conditions also, therapeutic conditions, MTP can be done. Next indication is the eugenic reasons, where risk of a child being born with serious physical or mental abnormalities is present. So if you continue with the pregnancy, there is a chance that the child may born with some physical or some mental abnormality. So that in that conditions, MTP can be done. Some examples like if the mother is exposed to teratogenic drugs like warfarin, or she has exposed to radiation exposure of more than 10 rats, then there is chances that some genetic abnormalities may be present. If she is suffering from rubella, German measles, chickenpox, viral hepatitis, or other viral infections, which are in fact during one's first trimester, in that cases also there is chance that some abnormalities may happen. Then structure abnormalities like anencephaly, where the brain development is decreased, chromosomal abnormalities like Down syndrome, any genetic abnormalities also in that cases also MTP can be done. Or if the parents have some inheritable mental conditions, in that condition also MTP can be asked under eugenic condition. Then third one is the social reasons. Here mainly to prevent grave injury to physical and mental health of a pregnant lady. So if a pregnant lady has issues which may lead to that she doesn't want to continue because it may damage physically or some mental health of the physical pregnant lady, then in the cases MTP can be done. Like some unplanned pregnancy. So she doesn't want a pregnancy, but there was unplanned was there with, and she is of so low social status in that condition, MTP can be done. The majority of the cases of MTP, 80% of cases are because of this socio-economic background, where they are of low socio-economic status and get pregnant unplanned, and they don't want to get MTP. And in case of pregnancy as a result of contraceptive failures, this is also one of the reasons where MTP is asked in social reasons, where they use contraceptive or because of contraceptive, they give an indication that they didn't want or unplanned pregnancy. In that cases, indication MTP can be done. Then humanitarian reason, the indications where pregnancy was caused by rape. So if there is a pregnancy caused by rape and the woman or a girl or doesn't want to continue the pregnancy, in that case MTP can be done. Or in case where the pregnancy is in mentally ill, if the woman is mentally ill and continuing it will adversely affect the woman, that condition can be done. Then environmental reasons, where the social and economic environment of the woman where she is present, which may be actual or reasonably expected, can injure the mother's health. So the environment which where she is staying or where there is a social interaction with where she is present may adversely affect the mental health of a mother. That condition also indication in that indication also MTP can be done. These are the 5 indications under which MTP can be done. Now coming to some rules of MTP which has to be followed to do MTP. So first of all, the rules related to duration of pregnancy. So this duration of pregnancy, this again has been amended in 2021. Few changes have been made, which I will discuss in future next slides. So first I will discuss about the which was present in the 1972, 2002 and 2003 amendment, whatever were present. So under this, the termination cannot be terminated after 20 weeks of pregnancy. So before in 2002 2003 amendment, the maximum allowed the is termination was up to 20 weeks of pregnancy. After 20 weeks, termination can be done. Below 20 weeks, up to 20 weeks, it should not be done. So in recent 2021, it has been changed to 24 weeks. Again, I will discuss about that. And in this MTP Act, 20 weeks can only be terminated if on the indication of emergency conditions. In emergency condition only, it can be terminated. So these two rules has been changed, and I'll discuss about that. Then up to 12 weeks of pregnancy, it can be terminated by opinion of a single doctor. And then that means that within 3 months, if the pregnancy is there, then only one doctor opinion can be can be used to terminate the pregnancy. Between 12 to 20 weeks, decision can be taken by two doctors. Now coming to place where MTP should be performed, these rules are same in both the in the recent amendments also. So MTP can be conducted in any hospital established or maintained by government agencies, or a place approved by government, or a district level committee with the chief medical officer or district health officer as a chairperson of said committee. So if this committee approves any place, any private hospitals or any nursing home can get approval by this committee, in that the chairperson should be a district health officer or chief medical officer. They can give the permission to conduct the MTP. Qualification: the experience of the registered medical practitioner who can do MTP. A doctor should have experience. So first, MTP under 12 weeks, that is less than 3 months of pregnancy. In that cases, doctor should have experience of assisting a registered medical practitioner conduct up to 25 cases. So he has to first at least have assisted 25 cases of MTP, out of which 5 should have been performed independently under the guidance of the registered medical practitioner who is experienced in doing MTP. And this should be done in the approved hospital in the government. Then up to 12 to 23 weeks, it can be done either by postgraduate degree or diploma in OBGY. Then 6 months of house surgery in OBGY, 1 year or more in practice of OBGY at any hospital. So the about 12 weeks, it has to be done by a doctor who has at least joined a PG course in OBGY, that is obstetric gynecology, or has been done 6 months of housemanship in the internship in OBGY, or 1 year or more practice of OBGY in any hospital. In emergency cases, pregnancy can be terminated by any registered medical practitioner. So that he can save the life of a pregnant woman. So in any emergency cases, there is no required experience. Experience is not required. Irrespective of duration of pregnancy, it can be done by any registered medical practitioner. So registered medical practitioner means he has to complete 4.5 years of MBBS course plus 1 year of internship. When he completes that, he gets registration and becomes registered medical practitioner, and he can do in emergency cases of any duration of any experience, only in cases where it has to save the life of a pregnant woman. Then regarding consent, rules regarding consent of woman is mandatory except when she is minor, 18 years of age, or mentally ill, or where consent is obtained from guardian. So other than that, consent has to be taken from woman who is more than 18 years of age, then it is necessary. Here it should be noted that consent of husband is not necessary. If the woman gives consent for MTP, she can get aborted the pregnancy. Their husband's consent is not required. Maintenance of register, rules regarding maintenance of register. The head of the hospital where the MTP is conducted has to maintain register regarding the details of the patients undergoing termination of pregnancy for a period of 5 years, and professional secrecy should be maintained. The details of the terminated woman should not be disclosed to anyone. Contravention or of breaking the rules: if the doctor breaks any of the rules of MTP, he is liable to punish with rigorous imprisonment up to 2 to 7 years. And if he is a government servant, he will be liable to face disciplinary action, including excluding from the service. He can be removed from the service also. Now coming to recent amendment, which was changes done in the 2021. So previously, as I mentioned, it was maximum allowed period was 20 weeks. So in this act, it has been increased from 20 weeks. So under this act, pregnancy may be terminated up to 10 weeks by married woman in a case of failure of contraceptive methods. It allows married women to also terminate a pregnancy for this reason. So here it allows both the married and unmarried woman. In case more than 20 weeks, it can be terminated. Opinion of one registered practitioner of termination of pregnancy up to 20 weeks of registration. Previously, it was 12 weeks. So up to 12 weeks, one registered practitioner has to be can take the pregnancy, can give the opinion for MTP, and for more than uh, 12 weeks, up to 12 to 20 weeks, it was 2 RMP was required, but now they have made only one is required up to 20 weeks of gestation. Opinion of 2 RMPs required, registered medical practitioner is required for gestation up to 20 to 24 weeks of gestation. Opinion of state level medical board is essential for pregnancy to terminate after 24 weeks in case of substantial fetal abnormalities. If more than 24 weeks of abortion has to be conducted, gestation of abortion has to be conducted, in that case, the state level medical board has to be present, give the opinion regarding the conduction of MTP. Then increase in upper gestation level of 20-24 weeks of in special categories of women, including survivors of rape, victims of incest, other vulnerable women like differentially abled women, minors, and among minors. So 20-24 weeks, just abortion can be done under special categories of women like survivors of rape, incest, or vulnerable women. The name and other particulars of woman whose pregnancy has been terminated shall not be revealed to anyone except to persons authorized in any law then currently in force. Other than that, name should not be revealed to anyone. The coming to methods of inducing abortion under MTP Act. So, since MTP is a justifiable or therapeutic abortion, this has to be done in hospitals. So, there are two methods up to first trimester, that is up to 12 weeks. It can be medical method or surgical method can be used. Under medical method, drugs like mifepristone, misoprostol, methotrexate, misoprostol, timofexine, misoprostol is given. After ingesting these drugs, they usually get aborted and products of consumption uh, are aborted or removed from comes out as a uterus. Then surgical method where manual vacuum aspiration is done, where manually aspirator is used, manual where vacuum pressure uterus inside the uterus the vacuum is applied and products of consumption are sucked out. Then dilatation evacuation, again similarly surgical method where cervix is dilated of the consumption are removed manually. Then suction evacuation or curettage is done where the uterus is curetted so that products of consumption is removed. Then up to 12 up to 20 weeks, then there is a dilatation curettage evacuation methods. Then intrauterine installation of hyperosmotic solution. So this hyperosmotic solution is interested into the intrauterine so that the volume of uterus is expanded and the fetus get detached from the detached from the placenta so that it get aborted. It can be injected into intraamniotic, intrahypotonic urea or saline or extraembryonic where ethacrylidine lactate or prostaglandins is injected. Then other methods includes use of prostaglandins. It can be used intravaginally, intramuscular or intraamniotically. When these prostaglandins are given, again it causes contractions and abortion occurs. Similarly, oxytocin infusion can also be given, which induces kind of contractions, uterine contractions, or hysterectomy can also be done to induce the abortion. Now, coming to complications of MTP, there may be immediate complications and delayed complications. In immediate complication, it may lead to hemorrhagic shock, mainly like surgical methods, dilatation, and curettage. It may damage some major arteries, may lead to hemorrhage and shock. It may cause also perforation of uterus, perineum, or intestine. There may be laceration of cervix or vagina. In dilatation, process of dilatation sometimes, if the cervix is dilated immediately, it may lead to laceration of cervix or vagina. There may be incomplete abortion. The part of aborted material products of conception may still be present in uterus. If any inexperienced doctor performs, there may be embolism where product of conception may detach, enter the bloodstream and get lodged in some part of the body. There may be thrombophlebitis where there is inflammation of the veins may occur because of products of conception. Then delayed complications, there may be pelvic inflammatory disease, menstrual irregularities if drugs like mifepristone are given. There may lead to sterility because of injury to ovaries, it may lead to sterility. There may be endometritis, that is infection of uterus. Then cervicitis, vaginitis, and infection of cervix or vagina may occur because of uh, not using any sanitation during causing MTP. These are my references. Thank you.